Lillian Reiki is a trained primary school teacher who taught at various levels in the school system for about 17 years. She also went on to work with her husband Andrew in a small business for a few years until something changed their lives forever. In the year 1993, their youngest son was born with severe health challenges. After seeing many different professionals, the consensus seemed to be that their son suffered from a condition known as ODD, Oppositional Defiance Disorder. It is kind of like ADHD, we've all heard of that one, Attention Deficit Hyperactivity Disorder, except with a few more challenges to deal with. Their son was aggressive, hyperactive, and just constantly being a difficult child. With the health challenges experienced by their son, Lillian and Andrew began a journey to set about trying to find the answers. I'm speaking with Lillian Reiki today. Hi Lillian.
Good morning, Dave. How are you?
Doing very well. Thank you for your time today. Wow. Tell us about this time in your lives. It sounds like you're at a total loss as to what to do with your son.
Absolutely, and it sort of giving me shivers up my spine just thinking back, I suppose, because Caleb is now 19 years old. I guess from the moment Caleb was born, he was a busy little fella. You know, as a baby, he did nothing but scream. If he wasn't being fed or wasn't sleeping, he was screaming, basically. So it was very, very challenging. By the time he was a toddler, it was quite evident that he was busier than the average child, and he was starting to show tendencies of aggression, which was really challenging for us because we were good parents. We had a passive home with an older child, a 7.5-year-old child that was quiet, and we just didn't know what to do. And while I was working, we had him in childcare at about age 3 to 4, and he was basically outcast from those childcare centres because they just couldn't handle him. He was a total challenge. He was aggressive, he was defiant, he was hyperactive, and nobody knew how to deal with him. It really, really was challenging.
Now, you are by no way against the medical profession, and it's far from it, but in the case of your son's ODD and ADHD, you say that you just had an intuitive insight, a little voice inside your head that there must be a better way.
Absolutely, Dave. Look, Caleb was first diagnosed by a professional at the age of 3.5. And would you believe the first diagnosis was childhood depression, which was recommended at that stage that we put our 3.5-year-old son on antidepressants. Now, of course, we didn't take on board that recommendation. That was crazy. I thought to myself, if anyone needs antidepressants, it's me. I wasn't coping very well. But anyway, look, there was no way I was going to put my 3.5-year-old on antidepressants. And from there, I guess we got other so-called professional advice and so forth. He was then diagnosed with conditions like ODD and ADHD, which you've already explained. And then recommendations were made for various types of stimulant drugs or amphetamine-based drugs like Ritalin. And we just thought, this is crazy. You know, I didn't know a lot about these drugs back then because I'm talking about, 16 years ago. It just didn't feel right to put a young child, still almost a baby, on these drugs. So I thought there's got to be a different way to handle these challenges that we were experiencing.
Why wouldn't you follow their recommendations? I know it's a very simple question, but when we think about it, the first thing you do is you listen to the doctor, you listen to the medical profession and just follow what they say. What was it about yourself and Andrew that went, we just can't do that easily?
Look, Dave, I've been the type of person, I guess, all of my adult life that even, is hesitant to take a headache pill because I try and deal with things holistic if I can and look for other solutions. But I knew enough about antidepressants and I certainly learnt enough about the stimulant-type drugs that they were giving these children. And you only had to do the smallest amount of research to look and see, hey, this doesn't look right, this doesn't sound right, there has to be something else we can do. I wanted to know, I didn't want a Band-Aid, I guess. I wanted to know why he was having these challenges and how we could help him. I didn't just want what could be potentially a toxic, Band-Aid just to try and mask his symptoms. I wanted to help, figure out why he was this way and how we could help him in a safer and more effective way.
And why was he having these challenges?
Look, you know what, I've come to the conclusion, and I've been asked this question many times over the years, and I think there's a combination of reasons, and it's different for every family and for every child. But I think if you look at our world today, we are living in a different world. You look at what it was like when we were children. even just 30, 40 years ago, and our world is far more toxic these days. And I believe that some children, for various reasons, are just suffering from toxic overload. And, that stems back to what we as parents do even preconception, what's in our bodies, what we eat, what we do, what chemicals we are confronted with. I've actually got a personal story that, my body was actually quite toxic because of a health challenge that I had, and I believe that a lot of this toxicity is passed on through birth to my son. That was one thing, but look, I don't know. Even in some families, you've got one child that's born okay and another that's not. Some are just more susceptible to this toxicity than others, I believe.
One of the great things about speaking with someone like yourself, Lillian, is that there'll be people out there listening to us speaking today who are going through exactly the same thing, and they're at their wits' end. What I'd like to know, was there times where yourself and Andrew really suffered from guilt and thought this is our fault?
Absolutely. We had another child and he was, I suppose, what we call normal or okay. And then Caleb comes along and we think, what's gone wrong here, what's different. There was something that did happen to me during pregnancy that I think did contribute. But, there's always a lot of, what have I done wrong? How have I, helped to cause this problem? And particularly with Caleb's journey, he's had quite a roller coaster journey, Dave, and he, actually his challenges started as a toddler, as a small little boy, and then progressively we helped him to be fairly even, and he coped pretty well through school. And then when adolescence hit, we had more challenges, and of course then we thought, what have we done wrong once again? So it has been a very, very much a roller coaster ride for Andrew and I, and we have learned so much, so much, and that's what I've shared in all of my books, because I do want to help other parents, and I've spoken to so many parents that are at their wits' end. They've got that same intuitive thing. They've had a medication, recommended by a practitioner, but they've not wanted to follow through. But they say, look, I just don't know what else to do. Where do I start? What do I do?
The darkest times that you've been through, you've described it as a roller coaster. Parents who are going through that now, what advice would you give them?
Okay, it's a little bit like making a cake, Dave. There's not just one ingredient that you can put in to make that cake work. There are lots of ingredients that you have to put in. And in the early days, we focused a lot on the physical things. And I still believe, don't get me wrong, these are very, very important. The physical things like your diet, get rid of all your colours, additives, preservatives, use good quality fresh produce, organic if you can. Eliminate and reduce as many additives in their diet as possible. The same goes with the toxins in the home. Reduce the toxins in your home from your household products, your personal care products. There are a lot of safer options out there today. A lot of parents don't realise how toxic, for example, a toothpaste is, or a shampoo can be, or a cleaning product can be. There are lots of things that you can actually do around the home to make your home a safer place. So there's kind of those simple, well, not simple, but it does take a bit of time, but the physical things that are really important, your environment, your diet, and so forth. But as we progress through this journey, we came to realise that probably, I feel, equally as important or even more important is the emotional side to the child, building up their self-esteem, their feelings of self-worth. And then equally as important again is our parenting, and that's something that I've really been focusing on in my last couple of books, how important it is, the type of parents we are, and the positive influence that we put across in our parenting, talking about what we want from our child as a parent in a positive way rather than what we don't want in a negative way is so important.
You mentioned additives, preservatives, all that sort of thing. There's a code breaker that you compiled, Hidden Dangers Code Breaker, and it identified food additives that are linked to cancer, asthma and hyperactivity. I thought that was very interesting.
It is. I did a lot of research for my first book, which is called Hidden Dangers, because we established quite early on that Caleb was very, very sensitive to particular additives in food. It's a bit of a minefield out there for parents when they go shopping to pick up a product and just see a whole lot of big words and numbers on the back of the label and have got absolutely no idea what they are. And there are hundreds and hundreds of food additives and colours and preservatives and all sorts of things in food that unless you're a very qualified scientist, you've got no idea what they all mean on the back of the label. I talk about those in depth in the book, but I put together just a little fold-up wallet-sized code breaker that you can take shopping with you, and in my opinion, anything on that code breaker should not go into your trolley.
How is your son these days?
He's absolutely awesome. I'm not half biased, but he's a beautiful young man. He's now 19. He is a third-year apprentice, a plumber, and he's doing very, very well. He didn't cope very well with school, like a lot of kids. He left school at 15. It's interesting. Our first son is actually a naturopathic doctor. He did 5.5 years at uni, 3 degrees, loved school, and our second son, Caleb, left at 15. Well, he was kind of asked to leave, basically. So once we got our head around, how we could, assist him in that and supported him and loved him unconditionally, regardless, then it all became very, very positive, because we did have a big dip for Caleb between about the ages of 13 and a half and 15, where his headspace wasn't very positive, and he was getting into a lot of trouble at school and was actually asked to leave several schools, and it wasn't very pleasant. But when Andrew and I got our heads around that we loved him unconditionally, that we were here to help and support him no matter what, we were his biggest fans, and when he felt that love from us and that support from us, he really started to improve himself, and he wanted to be better for us and for himself. So yeah, he got himself, did it all himself, got himself into TAFE, got himself an apprenticeship, and he's a very self-sufficient, motivated and loving and caring young man, and I couldn't ask for any better.
You've mentioned a couple of times that you've been an author as well. I'm guessing that many, many years ago you thought you'd never pen a book, but you've now been an author of 5 books. Tell us about the books and how they can help parents who are struggling with their child's behaviour.
Absolutely, Dave. I guess the books are a bit like a series. I mean, you don't have to read one to understand the other, but they really are our journey. So as I said, the first book, Hidden Dangers, it's got more of the practical stuff in it about food and about, toxins in your home, about nutrition, about self-esteem. It's got a lot of the practical stuff in it. And then I did a personal development workbook for children, which was my second workbook, The Best Me I Can Be. And that's to help parents and to help teachers to bring out the best in children, to help them believe in themselves. It's got lots of practical, activities and things. My third book was probably the one that I'm most passionate about, and you'll probably giggle at the title, but The Revolting Child, A Blessing in Disguise. And I wrote that when Caleb was about 15 years old, and if you were to read the foreword in that book, I'm sure you'd have a tear come to your eye, because Caleb actually wrote that foreword in the book for me. All I did was ask him to put his thoughts on paper, and it was quite profound to hear what came out of his mouth. And I had to actually ask Caleb's permission to write that book, because I wanted it to be honest, so that parents could actually see our dirty laundry, I suppose. I wanted people to really understand what we'd been through and what our journey was, because I know a lot of parents out there are embarrassed about their situation. I have parents on the phone crying because their child's been suspended again or expelled from school. They're fighting. They're always in trouble. It's not a pleasant feeling as a parent to have a child like that. So that book is really about that whole journey, Dave, that we've had with Caleb from birth right through to about the age of 15. And then my last 2 books have been more specifically about parenting. If you want kids to cooperate, just ask, which was book number 4, is really based on a lot of positive parenting tips. So actual, practical tips and ways to be, the best parent that you can be as well. And then my last book, which I've just written this year, is called actually The Best Parent I Can Be. And that's based on a lot of positive parenting, and it's based on the law of attraction. So it's based on really attracting what you want from your child and from your relationship with your children, and having a positive and loving and caring relationship with them. But a lot of that is based on what you are actually attracting from your child. Because we all know what we put out there is what we get back. So in simple terms, that's very relevant to parenting as well.
I've been speaking with Lillian Reiki today. She's been to the extreme lows and the extreme highs of parenting, and is willing to share that experience with other parents to try and help them as well if they're struggling with behavioural problems with their children. Lillian can be contacted at hiddendangers.com.au, hiddendangers.com.au, or 0418 393 298, 0418 393 298. Thank you so much for your time today, Lillian. Any last bits of advice for parents listening?
It was a pleasure, Dave, and my bit of advice for parents is, regardless of what's going in your life, remember you are your child's number one supporter. love them unconditionally, and just believe in them.
Lily and Riki, thank you for your time today.
Thanks, Dave.